He came in with a headache that sounded like a bad semester and left with a white ribbon in a jar. The part that still keeps me up is how long it had been living quietly in his head, making a home while everyone assumed every pain was just stress. My name is Daniel Reyes, attending neurosurgeon at a mid-size hospital off Highway 101 in California's Salad Bowl, a low, concrete building that smells like hot asphalt in the day and like the inside of a refrigerator at 3 in the morning. Our operating rooms sit under the ICU like stowed thunder. The scanners hum down the west hall behind double doors with signs that people read but do not see. The work is repetition disguised as rescue. The same hand positions, the same phrases spoken in voices measured down to the syllables so frightened people can walk across them. I always say what I'm going to do before I do it. It is a habit that makes me sound calm when I am not. On a gray Friday in late October, a 26-year-old college student named Luis Ortiz arrived in the emergency department with a headache that had been pretending to be finals week for months and, in the last day, had stopped pretending. He was slumped on a gurney in Bay 12 behind a thin curtain that did nothing about sound and less about smell. The ED light makes everyone look like they are auditioning for a part they didn't want. His skin was the color of holding your breath too long. He had a plastic bag looped around his wrist and was trying to make vomiting quiet. His mother was perched in the orange chair with her purse on her lap, as if there might be a moment when someone would say, "Tickets, please." The triage note said headache, worse than usual, nausea, confusion, brief episode of word salad per girlfriend, no fever, no trauma. The resident covering the ED had written migraine versus spiral versus something else, neuro to see. Something else is a phrase that lets you out of a room before you've earned it. I asked him how long he'd had the pain. He squinted at the ceiling because the ceiling is where people look when they can't find what they need in someone else's face. Months, he said. It's been like a belt. Tight. Then last night it felt like someone kicked me in the back of the head from the inside. He grimaced and swallowed. Sorry, he added, reflexively, like he had caused the room. Any fevers? I asked. Any vision changes? Weakness? Confusion? My girlfriend said I was talking. Funny, he said, and then smiled a little at the word, like he was trying to make it smaller. Like my words fell apart. His mother reached over without looking and rubbed a slow circle on his forearm with her thumb. He winced when he turned his head. He vomited again. Nothing left, just that stripped, dry heave that sounds like someone wringing a towel. The nurse clipped a pulse ox on his finger. The monitor threw numbers up as if doing so made them less personal. His blood pressure was up in a way that made my mouth taste like metal. His heart rate hovered just below normal, slow for a man his age and on this kind of day. Nausea, headache, confusion, blood pressure up, heart rate down. A triad I wish I could unknow. The body has only a few ways to say there's pressure where there shouldn't be. He was saying it in a steady, polite voice while standing near a cliff. We're going to get a CT of your head, I told him. It's a quick scan. No needles for that part. Just lying still. What is it? His mother asked, in that tone that tries to look past the next sentence for the one after. We don't know yet, I said, because there are many ways to lie and only one way to keep your hands from shaking in this job. The scan will tell us where to go. In the scanner a few minutes later, he lay with his head in the cradle, hands at his sides like a child who has decided to impress the teacher with how still he can be. The tech tape crossed his forehead and chin so our machine wouldn't take a picture of movement instead of brain. He tried a joke about claustrophobia, then swallowed that and closed his eyes. The machine sang its little alien song. The screen drew its gray in slices. There are only a few things you dread seeing because they bring with them a set of steps you will have to run whether or not your legs are ready. Blood where it doesn't belong. A mass with edges that pretend to be a promise. A big ventricle where a small one should be. On the third slice, something round came up out of the dark like a moon rising too fast. A cyst, fluid content, tucked near the left lateral ventricle and kissing it with enough tenderness to be cruel. The tissue around it felt crowded and brighter than it should be. And in the center of the cyst, a denser speck, like the period at the end of a sentence someone else wrote long before you knew the language. The tech clicked his tongue softly. "Is that?" "Yeah," I said. The room cooled against my skin. The radiologist jogged down the hall with the wet ink printouts in his hand like a runner finishing a relay he had never wanted to start. "Ring-enhancing lesion with central scolex," he said, grabbing the word we both knew and hated. "There's a second smaller cystic lesion posteriorly. Ventricles are full. He's obstructed." People say tapeworm with either laughter or disgust. They're thinking of a flat ribbon in an intestine like a bad magic trick. What Luis had was the larval form, a cyst with a creature inside that had somehow made its way through his gut, into his blood, and across the border to the brain, where it settled and lived like a polite, wrong tenant in a rent control unit for years. The central dot is the head of the thing, the part that in an unlucky life would have latched on to the inside of his gut and grown a body of repeating parts. In the brain, it curls inside its fluid pocket and waits. While it waits, your body argues with it, and the room inside your skull, already a tight fit, begins to revolt. Neurocysticercosis, the radiologist said out loud because someone had to put the right letters next to the picture. Obstructive hydrocephalus. He's going to blow if we don't drain him. "Page anesthesia," I said. "Call the OR. Tell them we're coming now. No food. Foley. He's getting worse." "Does he have seizures?" the ED resident asked from behind me, because people fold in the questions that fit into their knowledge like they're stacking laundry. "He has pressure," I said. "Seizures can wait their turn." In the little time we had, I explained it to him and to his mother in the way that feels like giving someone a map of a country while they're already falling through the air over it. "There's a cyst in your brain," I said to Luis, steady, not fast. "There's a small parasite inside it. It's been there a while. It's blocking the fluid that should move through and around your brain. That's why the headaches, the nausea, the confusion. We need to go in and drain the fluid and take the cyst out. If we don't, the pressure will keep going up." He blinked at me and then looked at his mother. She had the careful listening face mothers put on when they are trying not to make words like why and how explode. "A parasite?" she asked. "A larval tapeworm," I said, choosing the worst word clearly. "They're more common than they should be. People get them from poorly handled food, from eggs. Sometimes from pork that isn't cooked well, but usually from someone who had the adult worm and didn't wash hands. It's not a judgment. It's a bad accident of hygiene. It's common in parts of the world where sanitation isn't great. And here, too." She nodded like the floor had tilted and she was going to stand her ground anyway. Luis gagged into the bag and wiped his mouth. "In my brain," he said, slow, like tasting each word to see which one was the bitter part. "We're going to take it out," I said. "You came in time." "Is it going to hurt?" he asked, almost sheepish, like the question embarrassed him. "You'll be asleep," I said. "After, your head will feel used." He smiled a little. "Good," he said, "because it already does." We rolled. When we move like that, the hospital turns into a river. The doors open ahead of you like they've been trained for it since childhood. People press themselves into the walls. Vending machines glow with the same light they always make, refusing to be part of your day. The OR was bright and 68 degrees and smelled like a new notepad. Anesthesia met us at the door and put a hand on my shoulder the way colleagues do when they don't have time to say they're with you. After we had him under, we shaved only what we needed, a small square tucked behind the hairline over the left frontal bone. There is so much about what we do that is theater. The theater feels like a lie until you watch someone like Luis wake up with his whole hair still on his head and realize the liar here is the assumption that drama equals more care. We placed him in a Mayfield headrest, 3 tiny points of certainty that hold a head, still so the rest of the room can move. A small burr hole the size of a pea gives you an argument with luck. Too far and you're noise. Too shallow, and you're just pretending to be a surgeon, which is worse than noise. Scope, I said, and the scrub handed me the ventriculoscope like it might bite. It's a slender pipe with an eye at its tip and a corridor for irrigation, a periscope you push through what is not yours. You work while the screen pretends to be a window into a world you would never otherwise see. Water ran through the irrigation line warm from a basin someone had their hands in moments before. You move the scope gently, like slipping into a conversation. The brain's inside world is not red, it's pearl and smoke. Most days it feels like trespassing with purpose. We eased into the frontal horn of the ventricle. Clear fluid washed the camera. The walls of the ventricle pulsed slowly with the heartbeat, something intimate and rude I never entirely get used to. Farther back, just anterior to the foramen of Monro where the slender corridors of CSF talk to each other, a little pearly globe sat tucked against the ventricle wall. A cyst. Inside, a tiny white oval like a grain of rice looked back without eyes. If you get poetic inside your head, you should find a different job. Cyst, my resident whispered, unnecessarily. He's new enough to narrate, old enough to know when to shut up. We could have considered drugs, albendazole, praziquantel, and steroids to manage the inflammation that comes when the body realizes there's a trespasser in the wallpaper. But with the pressure where it was and the location where it was, the argument was short and had only one conclusion. Go slow, go steady, take it out, let the river of fluid flow again. I nicked the cyst wall at its thinnest place. The thing inside flexed, a white ribbon shifting inside its bag. The cyst leaked clear like a blister you broke on purpose. The pressure wave relaxed against my fingers on the scope. We teased the cyst toward the opening. It resisted everything resists, then slid, surprised that the world had changed rules on it. When it came free into our field, the larva moved once, like a thought completing itself. The resident took a breath he didn't know he'd been holding. So did I. We withdrew it through the sheath into a tray with a pad and a thin puddle of warm irrigation fluid to keep it from air, though it had been living in water, and air would not have done it the courtesy of killing it quickly. We broke open the cyst and set the larva in its own cup like a witness. It was small and white, no more dramatic than any other stupid object in an operating room, except for what it meant. I hate the way ordinary things take on weight just because timing makes them heavy. I irrigated the ventricle and watched the CSF clear on the monitor. The walls moved with the pulse, a lazy tide. We placed a small external ventricular drain to let the fluid out and the pressure decide to behave while the brain remembered its old shape. We closed. We cleaned. We wrote. When we wheeled him into the ICU, the nurse took him with that quiet marriage of competence and tenderness that makes me think of new ways to believe in people. His mother met us at the door with her hands clutched like she was carrying a small bird she had no idea how to keep alive. I told her we had taken it out and that he was going to be okay, and she put a hand over her mouth and let out a single sound like a person who has dropped a heavy thing she didn't know she was holding. What was it, she asked, because minds crave names like bodies crave salt. A larval tapeworm in a cyst, I said, which is the accurate and least helpful way to say it. We got it. The pressure is down. From undercooked pork, she asked, and then flushed like she was saying something ugly. Usually it's from eggs, I said, and chose my words the way you choose a path over thin ice. From someone who carried the adult worm and didn't wash hands, and then touched food. It could have been here. It could have been elsewhere. It could have been years ago. We can't know. It doesn't have to be anyone's fault. She nodded through that answer the way people nod through weather. Infectious Disease arrived with their cart and their questions and their gentle, skeptical faces. We talked about whether to give antiparasitic agents for any other unseen cysts and how to keep the body from overreacting to dead ones that had been quiet. They ordered serologies, though the scan had already given us the answer, and answers like to line up in 2s and 3s before they accept their place on paper. We gave steroids so the brain wouldn't swell in rage at having been asked to tolerate an intruder, and then informed it was dead. We watched the drains drip into a clear bag on a pole the way people watch rain and hope for the kind that grows things. Luis woke with the slow indignation of a person whose body has been used for good without his permission. He tried to sit up. I put a hand on his shoulder. "You're going to want to move," I told him. "Don't yet." He blinked. The light in the ICU is a mercy compared to BD. He looked at his mother. "Mom," he said, and started to cry without warning. Then he stopped and apologized for it, and we all told him to be quiet about apologizing, and he smiled at the scolding. "Head?" I asked. "Better," he said, and his voice had that tentative question mark in it. Like, someone turned the volume down. "Good," I said. "That's the point." "What was it?" he asked. He had been told. People have to ask again when they are inside the story instead of watching it. "A small parasite in a cyst," I said. "We took it out. Your skin looks better. Your pressure is down. You got here in time." "In my brain," he said, not disbelieving exactly. More like repeating a line until it fits in his mouth. "Yes," I said. "It's been there for a while." "How long?" he asked. "Years," I said. "We can't be precise. The body makes a house inside a house, and sometimes no one knocks." He flinched at the image. I should have chosen a different one. It's too easy to turn medicine into metaphor when the thing itself is bad enough. He slept. When he slept, the monitors performed for us, and we watched our screens like people at theaters who have forgotten the play is about a human being. The pathology came back like a polite memo. Cysticercosis cellulosi within fibrous cyst wall, scolex present, chronic inflammation of surrounding tissue, findings consistent with neurocysticercosis. The jar with the thing itself sat on my desk for part of an afternoon because someone didn't want to leave it in the shared fridge, and because we are human and there is a quality of being 12 years old about being a doctor sometimes that brings shame and humor in equal parts. It looked like a pale ribbon in a cloudy drink. The tech had tucked a paper towel under it because the jar had a small leak that would make the smell, just faintly of formalin and something else, a clean wet that felt wrong. I called pathology and asked them to come get it. The resident showed at my door and cleared his throat. "We label these," he said, and I nodded and pushed the jar at him like it was a hot plate. I derounded again and recommended a week of antiparasitics because his scans showed a smaller lesion farther back that hadn't caused the pressure but might decide to misbehave later if we left it to dream. They wanted to cover the dead in case the dead had friends who preferred not to be. We kept him on steroids to keep the body from making too much anger at old news. He didn't seize. That felt like stealing a win from a place that doesn't pass them out often. The hospital has a way of trying to turn stories into news. Someone from administration emailed, asking if I would consider participating in a community-facing narrative about uncommon illnesses to raise awareness. The subject line had the word story in it, and the body had the word viral, and I closed my laptop before I said something that would make me sit with HR for an hour in a room with glass walls and chairs that punish knees. The ED night shift had already told the night shift across town. Someone had come by to say hi and look at our schedule. People love a tidy monster, the kind you can point at and say, "There." That was the devil in the details. I have learned to keep my stories small because the people inside them are. On the second night, Luis streamed and woke on a soft gasp that set off the heart monitor and pulled his mother upright like a string. "I felt it," he said, sweat on the upper lip, somehow both boy and man. "I felt it moving." He put his hand to his temple and then took it away quickly because he didn't want to touch the wound. "That's your brain remembering pressure," I said. "It's going to do that for a while. Your brain is dramatic." He laughed once, amazed that he could, then grimaced. He told me later that the headache had started the semester before with a bad midterm and had made sense then, because teenagers are taught early to blame pain on failing to do what the world expects. The nausea came with it, sometimes after long study sessions where he forgot to drink water, sometimes after gym when he drank only that blue sugar water that makes everyone think they're younger. He had gone to the student health clinic once and been told to try magnesium and darkness and to unplug for a day. He had. It helped until it didn't. Then the words got slippery. His girlfriend, he said, had watched him reach for microwave and pull down window and laugh, and then frowned when he didn't frown with her. I thought about all the things that hide in plain sight because the story we prefer is cheaper. It is less expensive to believe in stress than to pay attention to a room no one can see without a machine we don't order often enough for younger people with debt and pride. I'm not going to eat pork again, he said later, like a person who makes a fair bargain with the air. He said it quietly, like someone talking to himself on the bus. You didn't get this from pork, I said, careful. Not directly. People say that. It's more often from eggs. From someone with poor access to hygiene who prepared food. Or from washing hands badly. We don't always know. You don't have to blame yourself for living. He nodded like I had offered grace, and he wasn't sure how to wear it. He went home on day 5 with a scar under his hair that his sister said made him look like he had survived a movie instead of a week. I told him the headaches might make echoes. I told him he might feel sensitive to light for a while or have days when the world seems too bright and rude. I told him if he got a fever or a stiff neck or if his head invented a new language of pain, he should come back without politeness. I told him if he wanted to finish the semester, he should, but slow, like a person wading back into water after almost drowning. He came back to clinic 2 weeks later with his mother and a bag of pan dulce from the bakery by the freeway. He put it on my desk the way patients put offerings they cannot name. He looked good. Hair growing back, the kind of color that suggests sleep. He had stories about the nurses' jokes and the one TV in the ICU that only showed cooking shows and how that had felt like a dare. He had a scan on a disc and a plastic sleeve like a promise. The fluid had settled. The little lesion posteriorly had shrunk. The steroids were tapering without making him feel like murder. He had not seized. He laughed without making his head ask for permission first. How long was it in there? He asked again, softer now, like a person asking about an old landlord. Years, I said, not elaborating because I had learned. I keep thinking about it, he said. That I was. I mean, I know it wasn't on purpose, but that something was living in there. He tapped his temple gently with a knuckle. And I was going to class. I was eating with my friends. I was sleeping. And it was like a roommate. That's an unfair roommate, I said. It didn't do the dishes. He smiled. His mother laughed out loud and then put her hand over her mouth again like laughter might get her in trouble. He did a small news interview months later that he didn't tell me about in advance. Someone sent me the link. The reporter stood outside our building in a coat, and the B-roll showed our scanner, and a voiceover said undercooked pork in the way bad information says itself into being. He told them he was grateful to be alive. He told them he would always think about how small and precise the knife sounded when I talked about it, and that the most important thing anyone said to him was that it wasn't his fault. He said, I'm going to graduate, and someone somewhere cut that into a headline with a question mark like it was negotiable. People will ask you, if you do this work, whether it's hard to come home and be normal. They do not understand that normal is the only thing that lets you come home. My daughter leaves her soccer cleats exactly in the path where you will trip over them and then feel bad that she is growing. My wife smells like oranges when she puts lotion on her hands after washing dishes, and I am reminded that smell is a form of proof. The dog, who does not know what I have in my head, puts her chin on my knee with the same weight whether or not I took a thing out of someone else's. The radio says something cheap about the economy. I take out the trash. I go to bed. I wake in the dark and stare at the ceiling for a while because the body thinks it can prepare by practicing, and then I sit on the edge of the bed and let the house be quiet around me. What stays from Luis is not the white ribbon. It is the idea that two lives can happen in the same room and neither will notice until someone panics. It is the sound his mother made when I said we got it, a sound that had been waiting in her throat for years without knowing its own name. It is the little flinch he couldn't help when I said years, which made me hate time a little more than I usually do. A year after his surgery, he sent a graduation photo. His cap sat wrong on his hair, as if trying to make a joke of itself. He had written on the back, "Thank you for the quiet in my head." I put it on the corkboard with other proof that the world does not only take. It sat next to a thank you card drawn by a child who had never seen my face because we were all wearing masks then, and to a postcard of the coast sent by a woman who said she had decided to like the way the ocean reminded her that pressure is a kind of home for some creatures. The hospital moved on, the way it does. We drained, we clipped, we excised, we closed. We told people the truth and watched it make a shape in their bodies that let them stand up. Once in a while, at 3 a.m, standing by the sink in the call room and washing my hands a second time because that's what you do when you are not sleepy and pretending to be, I would smell Lysol, our brand, not the particular apartment hallway version, and tobacco from a text breakout back because the vent had learned how to be impolite. I would think about eggs on a thumb and a sandwich and a semester that had been written off as stress, and I would say out loud to the mirror, it isn't a morality play, so I would remember not to let anyone make it one. It would be easy to turn Luis into a cautionary tale about food or travel or luck. That would make him palatable to people who need their stories to scold. It would also be wrong. The truth is smaller and heavier. Sometimes living is porous. Sometimes other lives get in. Sometimes they don't mean to. Sometimes they don't leave until someone cuts a new door and says, kindly, out. We kept the cyst in the lab for a while, cataloged and labeled, then disposed of it according to a rule I am grateful someone else wrote. I will not lie and say I didn't go down there once to look at it again. It looked like nothing special, like a thing you would toss back in a drawer when cleaning out a kitchen. I took a breath that smelled like chemical fruit and told it, against my better judgment, you're not a story. He is. Medicine pretends to be about numbers because numbers can be put in columns that make managers smile. Stories are not good with columns. They leak. Louis' story leaked into mine and into the EDs, and into the techs and into the nurses, and into the janitors who mopped the OR floor and had to wipe his hands twice on his pants when he left because the smell had made him think of the fish market where his cousin worked. This is the part the hospital doesn't write down because it would be bad for billing. We are porous too. The last time I saw Luis was 2 years after the surgery. He came to clinic with a friend who had migraines, and he wanted to make sure the friend started at the scanner instead of a bottle of magnesium. He looked excellent in the banal way that makes you grateful you have eyes, clear skin, decent sleep, the humble posture of a man who knows that good fortune is not a crown. He shook my hand and said, "Thank you for not making me feel dirty," and I said something boring like, "You're welcome," because the right words would have been too brave for a hallway. At home that night, the dog put her chin on my knee. The radio said something cheap about the economy. My daughter texted from the other room asking where her cleats were, and I told her the place she never looked, and she said, "Oh," and I said nothing because there was nothing to be gained by pointing out history's love of repetition. I went to the sink and let the water run hot and then cool. I put my hands an inch above the stream and felt the warmth lift into my skin the way pressure leaves a room when you drain it. I said to the air, because I have learned to talk to it, we got it, and the house stayed quiet in the good way. If there is a moral, and there isn't, not the kind you can embroider on a pillow, it is maybe that we don't always deserve what happens or what is inside us, that attention is not the same thing as guilt, and that knocking on a door is not an accusation. It is an invitation for whatever is hiding to answer. Luis knocked by lying on a table inside a humming ring and letting a machine look while he held still like a child trying to impress a teacher with how quiet he can be. We answered with a small hole and a long eye and water warmed in someone's hands. He left without the roommate he never invited. He wrote a note for my corkboard. And sometimes, at 3 in the morning, when the hospital finally remembers it is hollow and breathes in, I say his name in my head like a word you try in a new language and are surprised to find fits your mouth exactly.